Hello everyone. Today we are going to learn about edema. What is edema? Edema, it is an abnormal and excessive accumulation of fluid in the interstitial tissue spaces and serous cavities. We all know that it is important that there should be interstitial fluid in the interstitial spaces. Why? Because it provides an immediate environment for the movement of the ions, proteins, and nutrients across the cell barriers, and it is very important. So, whenever there is an excess of this interstitial fluid, or whenever there is an abnormality in the amount of this interstitial fluid, then it may lead to edema. So you have to know this, the two important words in this, the abnormal and excessive. Whenever there is an abnormal and excessive accumulation of fluid in the interstitial tissue spaces and the serous cavities, it leads to edema. Okay. So you can see from this definition, edema is abnormal and excessive accumulation of fluid in the, where it is, interstitial tissue spaces and serous cavities. The serous cavities, these are the body cavities in which the organs are situated. There are different body cavities like the ventral body cavity and the dorsal body cavity. Ventral, we have thoracic body cavity, then we have abdominal body cavity, then we have the spinal body cavity. So many body cavities are there. So what is the pathogenesis of edema? There is an easy way. Maybe people might also find it easy. I don't know. I found it easy. Like I used to learn the first letters of all the headings of the pathogenesis. See, I'll show you here. I used to learn like this. Pathogenesis includes, it's easy for you to write in the examination. P, C, L, C, S. You can learn this P, C, L, C, S, P, and you always have to remember C. In front of C, you have to put a sign of increase. Increase. Here, sign of increase. Okay. P, C, L, C, S. What is P? First of all, what is P? In the pathogenesis part, the plasma oncotic pressure. Plasma oncotic pressure. Okay. So the plasma oncotic pressure, there is an increase, there is a decrease in the plasma oncotic pressure. Okay, first point. Then secondly, C. C for capillary hydrostatic pressure. Then L for lymphatic obstruction. Then C for capillary permeability. Then S for sodium and water retention. So you can learn it this way. So what is plasma oncotic pressure? See, here is a blood vessel, and this is the interstitial space in which cells are present. Okay. So what does the plasma oncotic pressure does? The plasma-oncotic pressure, it has a tendency to keep the fluid within the vessel. Means it is a inward driving force. It drives the fluid inside the vessel. Inward driving force. Okay. So when it is decreased, then the inward driving force is decreased, and it may lead to more accumulation of fluid here in the interstitial space. Okay. So decrease in plasma-oncotic pressure. Now increase in capillary hydrostatic pressure. What is capillary hydrostatic pressure? This is the pressure which is the outward driving force of the fluid. What is this? Capillary hydrostatic pressure is a outward driving force. So it is increased, means more force on the outward side, means the fluid is going outside, means more accumulation of fluid here. So it is increased and this is decreased. And then the lymphatic obstruction. Whenever there is an obstruction in the lymphatics, then it may lead to edema. Now increase in capillary permeability. What is capillary permeability? See, the capillaries are permeable to a little extent, means so that they can lead to the movement of the ions, proteins and nutrients across the cell barriers. Okay. So for example, this is the blood vessel. Okay. The blood vessels have cells, the endothelial cells. See, just imagine these are the cells. Imagine. Okay, these are the cells of the blood vessels. So they have gap between them, which allows the nutrients and ions to pass through them. Okay, these are the gaps from where the things pass. But sometimes what happens, there is an increase in these gaps. Like this, increase in these gaps, which may lead to movement of large protein molecules and more proteins outside into the interstitial spaces. So when the proteins comes out, the water also comes out to the interstitial spaces, and there is accumulation of more water, then it may lead to edema. Now the sodium and water retention. Whenever there is retention of sodium and water, it may occur due to any renal diseases. So whenever there is retention of the sodium and water, it may lead to edema. So what all things leads to edema are, how does the edema occurs? When it's decrease in plasma-oncotic pressure, increase in capillary hydrostatic pressure, then lymphatic obstruction, then increase in capillary permeability, and sodium and water retention. I hope you have understood it, and I hope you have learned this part. So next we're going to talk about the classification of edema. Okay, now let us learn about the classification of edema. First of all, on the basis of pathophysiological mechanism. Pathophysiological mechanism. There are of two types, transudate and exudate. Now on the basis of location. On the basis of location, there are two types. Localized and generalized. Or they can be organ specific. So there are three types. Okay. Then on the basis of and then on the basis of clinical finding. First we have pitting edema, and second we have non-pitting edema. Pitting edema and non-pitting edema. Okay, so edema, the classification is, write your class C. The classification of edema on the basis of pathophysiological mechanism into transudate and exudate on the basis of location, localized, generalized, and organ specific, and on the basis of clinical finding, it is pitting edema and non-pitting edema. So let us learn about them in detail. Now let us learn about all these. The localized edema, what is it? It is a swelling due to excessive accumulation of fluid in a specific anatomic site. Whenever there is accumulation of fluid at a specific site, then it is localized, means in a localized area. So this is localized edema. The localized edema can be venous edema, lymphatic edema, and the edema may occur also due to any allergic reaction or inflammation. Now the generalized edema. Generalized means in the whole body. The generalized edema is also called as anasarca or dropsy. It's systemic in distribution. The generalized edema are cardiac edema, renal edema, or hepatic edema. The cardiac edema may occur due to congestive heart failure, and the renal edema may occur due to nephrotic syndrome, and the hepatic edema may occur due to liver cirrhosis. Now the organ-specific edema. Organ-specific edema can occur in brain. It is called as cerebral edema. It is also called as brain swelling. It may occur due to any acute traumatic injury to the brain like stroke, or it may occur due to chronic conditions like brain tumors. It is a fatal condition. And then the lungs. In lungs, there can be pulmonary edema. It may occur due to accumulation of the fluid in the air sacs, and it may lead to breathlessness. It mostly occurs in patients of heart problems. And then peritoneum. This is ascites. What is ascites? Ascites occurs. It is accumulation of fluid in the abdomen. In this, the patient shows the symptoms of increased abdominal size, increased weight, and there is abdominal discomfort and shortness of breath can be seen. So now let us learn. Now next we have to learn about the pitting edema and non-pitting edema. So now let us know about the pitting edema and non-pitting edema. What is pitting edema? Whenever a pressure is applied to a small area, the indentation persists even after the release of pressure. It is called as pitting edema. Whenever there is an edema and we press that particular area on the edematous part, and if we remove it, and still the indentation that we made from our finger persists there, then that edema is called as pitting edema. And when there is no indentation formed, then it is a non-pitting edema. See here, when a pressure applied to a small area, the indentation persists even after the removal of the pressure. It is called as pitting edema. And when the indentation made by a pressure on the affected area does not persist, it is called as pitting edema. Means the indentation does not persist, then it is a non-pitting edema. It's so easy. For example, you can see this sponge here. When I'm pressing, the indentation is not made. So We can give an example of non-pitting edema from this. Okay, so the causes of the pitting edema are liver diseases, kidney diseases, heart diseases, maybe the valve problems, and the deep venous thrombosis, etc. And the causes of the non-pitting edema can be lymphedema, that is lymphatic obstruction, or mixed edema. So here is a pitting edema and non-pitting edema. So now let us learn about the transudate edema and the exudate edema. It is an important question to give difference between the transudate edema and the exudate edema. Okay, what is transudate edema? It's a filtrate of blood plasma without change in the endothelial permeability. What happens, it is actually a filtrate of blood plasma. Whenever there is an increased pressure in the veins and capillaries, the water flows out from the capillaries into the interstitial spaces, or it can also occur whenever there is low level of plasma proteins. So this is the reason for this. And in case of exudate edema, the edema of inflamed tissue, it is the edema of inflamed tissue, it is associated with increased vascular permeability. Whenever the endothelial cells of the capillaries, a large gap is created between the endothelial cells of the capillaries, and the proteins and the water fluid can easily flow out from it, then it can cause exudate edema. Okay, so in this case there is increased pressure in veins and capillaries. In case of transudate, there is increased pressure in the veins and capillaries, and or maybe low plasma proteins. Okay, and in this case there is increased vascular permeability, that is the endothelial cells are far apart, a gap is created between the endothelial cells of the vessels, and the proteins and the fluid can easily come out. Okay, now the transudate edema, it is also called as non-inflammatory edema, and the exudate edema is an inflammatory edema. The transudate edema, it has low protein content, that is less than 1 gram per dl. And in case of exudate edema, it is high protein content, that is nearly 2.5 to 3.5 gram per dl. In this case, in the transudate edema, the glucose content is same as in plasma, but in case of exudate edema, the glucose content is low, that is less than 60 mg per dl. I hope you have understood it, and if you write this all in examination, you can get really good marks. So thank you so much for concentrating, and I hope you have understood what I have taught. Thank you so much. And if you people like my video, please do like, subscribe, share and comment. And if you people want me to make more videos on different topics, please do tell me in the comment section about the different topics you want me to make video on, that you want to learn. Thank you so much.